Hello, welcome to Smile with Pediatrics. Today's topic is the Easy Sepsis Protocol. As sepsis continues to remain a disorder of significant global concern, several authors report that adherence to sepsis bundles yields better outcome in patients with sepsis. Many sepsis bundles and protocols are in existence, including international guidelines, as well as local bundles which are designed to suit particular settings. The Easy Sepsis Protocol is an ingenious pediatric regimen that requires only the most basic equipment and has a flexibility that accommodates modification for use in various settings. EASY stands for Early Attention to Sepsis in the Young and is composed of two elements, a sepsis bundle and a stepwise algorithm. And what is so unique about the EASY protocol? EASY nips it in the bud. The protocol is designed to proactively identify, halt and reverse sepsis right from the stages of infection and the early stages of sepsis and septic shock. From the onset, EASY incorporates triage and categorizes patients into groups that receive different first-line treatments depending on the findings at presentation. Thus, EASY is an individualized, patient-centered sepsis regimen. And the best part is that EASY requires very minimal technological and laboratory facilities, which makes it easy to use in almost every setting. So we say EASY is easy. The next question is, who gets the protocol? The EASY protocol should be administered to every child who presents with an infection that meets the criteria for admission into the hospital. And these criteria are as determined by the hospital's existing practices and standards. The bundle and the algorithm should be administered concurrently and are mostly completed within the first 60 minutes of admission. Only a few items like the fluid and inotrope regimen may extend beyond 60 minutes. Each child gets some or all of the items in the bundle depending on how they present. And these items are vital signs check, bedside glucose test, point of care testing for endemic infections, for instance malaria, dengue fever, etc., samples for cultures, and urine output monitoring. The interventions in the EASY bundle are give oxygen if needed, respiratory support like CPAP, high flow or others if working to breathe, empirical antibiotics and antimicrobials, intravenous glucose bolus or glucose infusion as needed, and the fluid regimen, that is, fluid boluses or no bolus. So the EASY bundle contains 5 tests and 5 interventions, and these mnemonics are helpful for memory. The tests are Q's with a double S, where C stands for culture, U for urine output, E for endemic infection tests, S for sugar or glucose test, and S for signs or vital signs check. And the interventions go far, where G stands for glucose infusions or bolus, O for oxygen, F for fluid regimen, A for antibiotics and antimicrobials, and R for respiratory support. These 10 action points make up the EASY bundle. The other components of the EASY protocol, the EASY algorithm, helps to determine the fluid regimen and to determine between giving boluses or no bolus. It also guides the respiratory and circulatory support in the emergency room and thus complements the bundle. Remember that not every patient needs to get all 10 items of the bundle. It should be individualized. This brings to the fore the physician's expertise and judgment in treating sepsis, and this is the current concept regarding the use of sepsis bundles. Don't forget that every patient is unique. Indeed, in life, nothing is rigid. Our next video will feature a continuation of the EASY protocol. It's all easy peasy. Thank you for joining us on Smile with Pediatrics. Please remember to like and subscribe to our YouTube channel.